My name is Gina. I'm 50 years old and I am a resident of Port Moody for the last 13 years, resident of Vancouver for the last 20 years. I was diagnosed with multiple myeloma in October of 2018. In July of 2018, as I was bending into an oven, I'm a nutritionist and a private cook, and I was actually cooking for a bistro at the time, and I literally broke my back. And it turns out to have been in 6 different places, 6 compression fractures in my back, and eventually through emergency and finally getting into a family doctor and having some certain tests done, we had a diagnosis of multiple myeloma. The thought was that the multiple myeloma, the blood cancer, had managed to weaken my bones enough to actually, in a movement such as bending into an oven, actually create a lot of trauma. I heard about Dr. Gurm through becoming a registered holistic nutritionist and wanting to check out who my naturopaths were in my community, and that is actually how I found out the integrative approach that Dr. Gurm was using. I always knew that if I needed her or that sort of therapy, that I would be coming there. And in October of 2018, I did just that. Dr. Gurm was great because she's so knowledgeable and has so much science behind it all. She had begun to know who I was, and she understood that having a very autonomous sort of health plan was very important for me, to not be roped into I'm labeled as such. So she really understood that. But at the same time, those numbers, those diagnostics are there, so we were always there with those things to go through it. That was very important, to be supported emotionally in my decisions, and to know that I could come here and speak to any other fellow patient, as we, IV'd up and we got to share our stories and talk about, the highs and the lows and the everything, the reality of it all. So that community and that support was very, very important. The treatment that I underwent the most was high-dose vitamin C, with the intention of keeping my immune system extremely strong as I went through the chemo that was slotted for multiple myeloma, for the type of multiple myeloma that I have. And so I kind of sailed through. I did 3 months of chemo and I responded incredibly well and fast. The clinic it's been amazing. I started my treatments here before I started chemo. I was very adamant about that. I really wanted to get my body into the strongest state possible. And so I knew that I could be helped with that here. I feel that Dr. Gurm, she seemed to know when to kind of push things a little bit sometimes. There were a lot of emotional issues to work through with me. I was able to talk to Dr. Gurm about all of that. That was all part of it. Nothing was off the table. And that's what's true integrative. It's not just, I understand that she deals very much with cancer care, but she's made it so much more than that. And even this expansion and adding Reiki and all these other things, it's amazing. So now I'm doing preventative therapy. Once a month I'd come for an IV, a vitamin C IV. I'm just over a year of my last chemo, so I'm remaining stable. At Port Moody Health, I found that it's just another community of people who really get you. And so I feel grateful that when I walk in, there's hi, and we all talk to each other and ask how we're doing, and it's wonderful. So Dr. Gurm was great about seeing my husband and I together, and she helped quell his fears a little bit. She's just very nurturing and very kind, and I found that I could really just be myself and safe with her. When someone is diagnosed with, such a word, the C word, it's the C word. It will become clearer. It just will, and I think that it's natural to have that underwater feeling and to actually allow yourself to be okay with feeling that. And I tell my friends and my family and the people that I love all the time that I believe my cancer diagnosis saved my life, that it brought forth, health issues that I didn't know existed. So I feel very, very grateful, very, very grateful. And you will find gratitude. You will find the blessings, but you don't need to rush it. But it's there. Yeah.